Hi counselors, welcome to another video from Counselor Tips. In this video, I'm going to be talking to you about integrated care. What is it? What does it mean? How do I know that it's happening? Can I identify it? Do I want it? Is it something that I support? Hopefully this information that I cover in this video today can help answer some of those questions for you. We sometimes have the idea that we want something until we hear about it or we watch it in action, then we go, it's not for me. So let's clear up the confusion as to what really integrated care is. So hang in there as we cover this information, gives you a better idea of what integrative care is and if it's for you and your clients. Integrative care at its basis is the ability for providers to collaborate services in order to provide more holistic treatment to the clients they serve. So what is this collaboration? Well, it kind of looks like some of these. It would be you as a provider being able to work as part of an interprofessional team that can consist of mental health, behavioral health, physical health, clients, and family members. So it's much larger than just you and the client. When a provider is part of an integrated team, they're respecting and appreciating each person's role in this team towards holistic care for the clients. As part of a team member, you are maximizing your role by sharing responsibilities as well as recognizing any limitations that you or other members of the team may have in seeking out knowledge and support when you can recognize these limitations in yourself or others. As part of a provider who is collaborating care for clients, you're to support the team in the client's strengths, problems, as well as plan of care. As a provider that's working as part of the collaboration process, it would be your job to also help guide and influence other people that are part of the team for best client care. When you're a part of a collaborative team, it is expected when you're one of the providers that you will appreciate and actually elicit differences in representation and opinions in order to find the best solutions to provide best client care. As a team member, you're also an advocate for the client. As a team member of collaborative care, you're sharing knowledge, communication, and decision making. As a team member, you would need to be flexible and adaptable and be able to respond to the client's or other providers' needs in a timely manner. You want to be caring about your clients, but in a place where you don't have expertise, you are going to be giving trust to the other provider and keeping hands off in areas where you're not an expert without feeling threatened by somebody else coming in and using their expertise to support the client in common. Being part of a collaborative or integrative team requires you to have great communication skills. You need to be able to quickly and actively build rapport with the other providers, the team members, the clients, and the family members that are invested in the client's care. This means that you need to practice active listening, which requires you to use head nods, minimal encouragers, lean in, ask open-ended questions, and paraphrase accurately. This will require you to have jargon-free communication, remembering that other professionals may not have the same training as you, as well as clients and family members may not have any training at all. So we want to keep communication clear and concise. When you're part of a collaborative team, you have non-judgmental interactions with others. Respecting their differences is vastly important. It's part of successful treatment for the client. You want to be able to provide educational resources not only to the client and their family members, but to other providers that don't have your specific training. In addition, if one of your team members is a different style of provider, like a medical professional, and they're offering you educational material, receive it graciously to enhance your ability to be a better team member. In addition, around interpersonal communication styles, we want to recognize and acknowledge potential bias that we may have when working with certain family members, clients from certain backgrounds, or providers with different personalities. When we're part of a treatment team, we have to also acknowledge that there may be cultural differences and we need to adapt. We need to be able to provide services that are culturally congruent to the client and their family. We need to be able to identify healthcare disparities that may exist to the client and their relatives. We must adapt our services to provide services that are relevant to the client and their family. We must be able to adapt our services in a way that they are meaningful and help facilitate a collaborative relationship between the providers and the client and their family. We must recognize that quality of care may need to be adjusted in order to address differences between the treatment team and the client and their family. We must be willing to educate clients and family members, remembering that they don't have our level of education, and when we are providing this style of education to them, we are doing so, again, jargon-free and at their level of understanding. As a treatment team provider, we also must value diversity and foster an environment where diversity is welcomed. Remember, people aren't always learning from us. Sometimes we're learning from others. Part of being a treatment team member means that we are agreeing on screening and assessment. This means that we must have the ability to conduct brief, evidence-based, and developmentally relevant screening of clients, as well as arrange for more in-depth assessments when needed. In collaborative care, we are screening for high-risk and harmful behaviors, such as a person having addiction, which can affect their mental, behavioral, and physical health. We're screening for things like suicidality, which again can have an impact on all aspects of the client's life. With integrative care, we would be providing a multitude of different screenings based on the provider's expertise. So there may be emotional screenings, behavioral screenings, cognitive screenings, physical health screens, screenings for symptoms for diagnostic purposes, screening for any kind of abuse or neglect, as well as looking at the client's full needs, such as socioeconomic needs, and making a referral in-house to a person who can help provide those resources to support them. When providing collaborative care for clients, our care is often based on strength-based premises. This means that we look for the client's strengths so that we are helping them work towards wellness and recovery. When part of an integrated team, there is care planning and care coordination involved. Providers that are working in an integrative system must have the ability to create and implement integrative care plans. This helps ensure that clients are linked to needed services. We also want to include anyone who's a stakeholder in the client's care. That's other providers, supports, the client themselves, and trusted family members. The level of care is dictated by the client's needs, and in an integrated care plan, there is less risk of services being duplicated. In an integrative team approach to client care, there is of course collaboration of providers' services, but oftentimes community resources are included in the client's care plan as well. When working as a collaborative provider, It is frequent that clients will be scheduled with one provider after another in the same day for similar services to support the same care plan. When you have the same client care plan, it's easier for clients to navigate services because there is no confusion with one treatment plan. And lastly is the intervention. With collaborative care, interventions may assist in these ways. They may be directed towards a client's crisis. The collaboration may be directed towards brief treatment. Treatment may focus on medication-assisted treatment with some behavioral interventions. There's frequently an educational component in collaborated client care plans. Overall, though, providers have the ability to provide clients with a range of brief, focused, often prevention-oriented treatment and recovery services. There's also the ability for clients to receive long-term treatment options and address clients with persistent illnesses. Thank you for joining me for this video that briefly covered integrated client care. If you think that you're learning from counselors' tips, consider subscribing to the channel. I'll see you soon.